Okay, fabulous. So welcome. I am Jane Hoagland. This is uh, the YMCA Virtual Connect seminars that we do every Wednesday at 4 p.m. So I'm super excited today to welcome Carol Connors. Carol's with 65 Senior Street. Carol has spoken at the Harris Branch with us before. She's been doing this for 12 years and she knows a whole lot about senior living and kind of what you need to know about what's going on in the Charlotte community, what you need to be thinking about if this is something you're planning to do. And I've actually had, great personal experience working with Carol too. So if you ever have any questions, want a referral, I'm your girl. But anyway, I'm going to turn this over to Carol. Hopefully y'all can see her screen here. Carol, welcome with us. Thank you for being here today. And Carol, let me ask in advance, if there's questions, how would you like to handle that? Would you like to wait till the end or are you pretty much comfortable?
Yeah, we could do a pause and take any questions, but let's wait till the end because there's not a lot of slides, but there's a lot of information that goes into each one. So if it's something that you feel, maybe at the end of each slide, we can take some questions.
Okay.
If that would work.
All righty. Well, thank you, Carol.
Great. Well, thank you. Thank you, Jane, for inviting me. Some of you may remember me. I spoke last year at the Y in person before COVID and everything else happened. So, just today I want to talk about a little bit about what's going on in senior living because there have been a lot of questions, a lot of misinformation, a lot of overinformation, underinformation. So I think it's important that people understand how assisted living is handling COVID, how residents in assisted living are handling COVID, and how family members of residents are handling it, and just really what's going on to kind of reassure you guys that despite everything in the media, there's a better picture to be painted here, as if any can be painted with COVID, because of course that's just been prevalent through everything. My background is in senior living. And so for the last 7 years, I've had 65 Senior Street. So I help people find different resources for senior living and focusing primarily on community living, whether it's independent living, lifestyle, assisted living, dementia care, long-term settings where you're still active, but you get a little bit of care, but also the different resources that are available in Charlotte to help you stay healthier longer, to help with disease management, to help you stay home longer, to keep you connected, and just in an effort to try and be a great resource for people who really want to know what's out there for them, no matter what they've decided, and how to make that decision and figure out what it is you do want for yourself. So I'm going to start again with what's going on in senior living right now. Maybe.
Hey, Carol, real quick, can you make your screen so it's like a slideshow? Because we're seeing some like Zoom and meeting controls at the bottom.
Oh, okay.
Okay, that went away. That's at least better. Okay.
Okay.
That's better.
See.
I think there's a start slideshow, but I'm not sure.
There is. Okay.
There we go. Perfect. Thank you.
Thank you. Okay. So COVID, it's been going on since February. It really hit Charlotte probably the second week in March, where people started really being aware that we need to start shutting things down, taking precautions, stop group activities. My last presentation was actually at Sun City the first week of March, right before everything shut down. And we had about 85 people there. Nobody became sick afterwards, but that was the very last day that we were doing any kind of public speaking or doing any kind of group activity, and the same for Sun City. So looking at the news, it's been a lot of bad news, specifically for seniors and for hospital settings. So hospital settings have been the worst hit, and that's obvious because that's where you go with the symptoms. When you go into the emergency room, if you're having symptoms, it's there and it can start spreading. If you do not have any symptoms, or you're in the emergency room for something else, a fall, surgery, whatever it is, whatever it might be. When you get tested automatically in there, some people start testing positive. So we started to learn a little bit more about this disease in March and April, about the wide range of symptoms, about the prevalence, and about how quickly it can spread. Because once one person was identified, you saw 5 or 6 people related to them. And it started to move like wildfire through some of the skilled nursing. People were being discharged from hospital to skilled, and it was several weeks before they started doing any kind of COVID testing, a couple of months before there was COVID testing really available, to make sure that they weren't sending this into the facilities. Um, Hospitals and skilled nursing are very hands-on care scenarios. So you have body fluids, you have close contact, you have a lot of heavy hands-on assist, you have close setting with people in waiting rooms, waiting for tests, a lot of people on the floor, a lot of staff going in and out for maintaining and providing care. Um, and it's all in a closed setting. In nursing homes, you had companion rooms as well, and people using the gym and the equipment. So it was much more easily spread. When they realized that, they started doing a lot of screening before they moved into assisted living. And that's where you see the real drop off. So while the media describes senior living as nursing home in general in the media, what they're talking about it as one big lump, um, group of community living. Where it's been hit is hospital and skilled nursing. There was actually one article, I've written into a lot of media to suggest corrections to some of the misreporting, and one of them actually had that Atrium was moving all of their people out of all of these assisted livings up into a COVID heavy skilled nursing so they could all be together, and it was actually on. It was WBTV. And so I saw that and I immediately emailed the newsroom and the reporter, because it looked at the list and they had about 12 assisted living communities that had nothing to do with Atrium Health, and the article said they were all being moved out of there. And I thought the panic that was created with family members, with staff, with everything else, that's just typical of the kind of misreporting that was going on because of terminology, because of the rapid search for information. So if somebody went on to an Atrium website, they saw all of their partners that they have clinics in or where they visit, and they took the whole lump of communities and said they were all under Atrium dictates to move to a skilled nursing with COVID. So there was a lot of misreporting, and there continues to be misreporting, although it's it's getting better. Um, so in fact, one of the places that you can look and see right now, every week it's updated Tuesdays and Fridays, is the link on this PowerPoint presentation, and that will show you ongoing outbreaks in community facilities in the Charlotte area, in North Carolina, actually. And you can look by county at skilled nursing homes and then at residential care facilities, so group homes, assisted living, memory care. And then it'll also have things like prisons and et cetera, where it's congregate living. But all adult care homes, 6 people or over, assisted living, memory care, et cetera, are there. And you'll see that there's usually large clusters. You're going to see a lot in the skilled nursing, and that has increased in the last 2 weeks. The list has more than doubled. Um, Senior living, assisted living, it's pretty much the same folks that have had spurts and then seen a reduction and then moved ahead. But on the whole, it's just a small fraction of assisted living. Figure about 5 assisted livings for every skilled nursing home in Charlotte, and you'll see it. A bigger prevalence in places like the continuing care communities. It has nothing to do with income levels. You know, you're seeing it at the Southminsters, the Plantation Estates, the Sharon Towers. And I don't want to misspeak because they don't all have it right now, but some do. And that is just, again, because of the high level of care that they have there, the amount of activity, and the level of hands-on. So the bulk is going to be in skilled nursing and then it'll trickle down to more hands-on, so memory care, et cetera. Overall, they've got a great handle on it. They're testing people, they're testing employees and residents weekly in most of those. They are screening residents, and if a resident has to go in for if a family member goes in to visit, they're doing screening for independent living, and you're wearing PPE, so protective equipment. If you go in to visit somebody in a hospital, in an assisted living, or in a skilled nursing home. So they're being very, very careful. Residents are not permitted in any care setting to leave overnight and come back without submitting to a quarantine. Same with if they've been to the emergency room or in the hospital overnight. So if they go to the emergency room, even during the day, they're quarantined for 10 to 14 days, depending on the community. Just to make sure that they don't have symptoms, and then they get successive COVID tests throughout that to make sure that they've had 2 that are negative. So that's the care that you're getting in there. How it's affecting it, limited activity. They've opened up some activity, so you're going to see small group engagement, limited dining, usually 1 or 2 people at a table, and then staggered meals. You are seeing changes in staffing. A lot of it is because if you have a symptom, you're going to be quarantined if you're a staff member. If you've been exposed, you're going to be quarantined if you're a staff member. You're seeing a lot of their budgets going to sanitizers, to protective equipment, to education, to extra hands-on care for those things. So you're seeing less inactivity. They're not going out to as many places. Vans have to limit their seating because of COVID regulations. So you're seeing that in reduced activity. You're seeing that typically in reduced menu options in food, because the bulk of the budget right now is being allotted toward meeting regulations and making sure that the residents are protected, as well as the staff members. Right now, they've had a tight budget. They just got approved. I think there was a package approved to help assisted living communities that were non-Medicare recoup some of their losses in the cost of training and of providing equipment. And so you'll see that start to flesh out a little bit. Lower cost to move right now at a lot of places. They've had a lot of openings. Movement's been stagnant other than emergency moves. But over the last month or 2, you've seen an increase. So you're starting to see that gap fill. Things should go back to relative normality in a few months. I know there's a vaccine that they're looking at, and I think the governor just said he has 84,000 vaccines allotted to go to long-term care and healthcare facilities. And that sounds like a lot, but when you figure Atrium has 16,000 nurses, plus you add on caregivers and housekeeping and the others that need to be protected, plus the patients, right there, you're back at about 40,000, then add Novant, then add the VA, and add some of the others. You'll see long-term care settings getting the vaccine, but primarily it's going to be in skilled nursing. And then you'll see it trickle down into assisted living. So the more hands-on care that they get, the higher the risk they're at. They'll get it first. And then you'll see it go into making it available for teachers, for people over 65, people with pre-existing health conditions. And I would anticipate that you'll start seeing maybe February and March at the rate they're going now. Still good, but still, practicing a lot of precautions until then. Does anybody have any questions about COVID right now? I should go back. Do you have any questions about what you've seen? Okay. And I am going to go back into slide presentation. All right, so where does that leave the future of care, which is where most of you are probably going to be taking a look at. Things are changing very rapidly in senior living. So right now, let's look at home care. In the home, you see more telehealth. So where you're not actually physically going to the doctor, you're seeing them over your computer or you're doing phone visits. That's a double-edged sword. It's convenient, but you also have to be a little bit more descriptive about what's going on with you. Make sure if it's harder to do a physical exam, obviously over the phone or even over the computer, unless they're looking at a very specific thing. So you're not going to get that full experience, and the doctor's not going to get that full experience of the patients being in the office. So when they're ready to go back, I think, other than those who cannot get out to the doctor easily, we're going to see more going back to the office. Um, you're going to see Medicare coverage for home care. I think that'll be what's lobbied for. It'll be a while. Right now, you're seeing it for the highest need, wound care, respiratory, things like that. Um, you're going to see more NORCs, which is a naturally occurring retirement community. And essentially what that is people in patio home communities, whether they're senior or not, or the 55 and older lifestyle communities, pulling together and sharing resources. So if you need a 4-hour shift to get a home care person in, and some are starting to allow you to divide it between maybe 4 people in your community. So 1 hour, a nurse would go in and do diabetes care or do respiratory care or do wound care, and then go on to the next home in the similar environment. And that way, the home care gets to utilize their 4 hours so that it's cost effective for a nurse to go out. And you can get more care as a resident in one of those communities. You can get more care on site. That's just kind of emerging. Some people are doing it, few are, but I think you're going to see that trend over the next 2 years really, really increase. New technology is becoming available. We've had, more accessible phones, things like the jitterbug. You have ringers. You have link to cell. So if you have a cell phone and you need it linked to a landline handset, you can do that. You're seeing apps available in the home to monitor different things like your blood pressure. Hospitals are providing equipment that they can monitor remotely. So you're seeing more of that technology, and that's going to increase in the future. Again, the double edge with that is you get part of the picture, but you don't get the whole picture. So you want to be really careful to make sure that you're sharing everything, keeping a log of symptoms. If you're using a lot of technology and you're using a lot of telehealth, so that in that span that you get to visit them with the doctor, that you're asking the right questions and you're making sure you're bringing things up. Um, Most of the resources for what people need at home right now, due to limited accessibility to things, are going to be private pay resources. So transportation, meals, companion care, which is different than home care. So companion care does not use hands-on care, but home health can. So they can do things like bathing, dressing, showering. Companions are more for things like transportation, meal prep, supervision, activity, things like that. You're seeing more of a trend again in intergenerational living. That was kind of put to a halt with COVID. Um, you're going to see that start up again, though, because working parents need help with kids. Parents need some conveniences or maybe just a little bit of monitoring, but still have a lot of freedom. So you're seeing people go back to what they used to do in the 50s and 60s and 70s, where mom moved in with somebody, or even in senior living, some of the newer senior livings that are being built. In fact, one of them is being built by the J. You're going to see younger folks on the same campus with older people, so that they will have that community option. They'll be able to volunteer, and you'll see some of that. In community living, you're going to see a bigger shift to wellness. So you're going to see more gyms. You're going to see more therapy rooms on site. You're going to see more offices available for physicians to visit. You're going to see a lot more community gatherings to keep sharp. And you're going to see more educational things. You're going to see more lifestyle options. So in addition to being able to buy communities like Sun City or some of the others that are 55 and older, lifestyle communities restricted just to retirees, you're seeing apartments pop up all over the place. Overture was one of the first in Charlotte to hit that mid-range, that $2,000 to $3,000 upscale apartment living with a lot of activity, but not care options on site. So it's becoming more affordable. It's for people that really aren't ready to plan long-term or aren't sure what they're going to need long-term, but want more access to social opportunity, easier living, walkability to shopping, things like that. And they are going up like crazy all over the place. You're going to see at least another 7 or 8 new ones by the end of 2021 in Charlotte and in the surrounding areas. And that's really because they don't require regulation. You have to apply for beds for assisted living. You have to go through a lot more regulation. In lifestyle options, you can build just like a regular apartment building, and then you can contract out if people start to need services in the end or later on after they move in. You are seeing higher care costs that are happening in assisted living right now. Again, as regulations increase and COVID will leave a lasting impression on infection control, you're going to see more nurses needed to meet regulations and to monitor regulations. You're going to see more equipment and more material goods to sanitize, for caregivers to switch on and off gloves, gowns as needed, etc. And then you're going to have extra caregivers for some things. The result of that, I anticipate, is whereas over the last few years, some assisted livings have been able to and willing to manage a higher level of care, so catheter care, ostomy care, two-person assist for some people with a higher physical need, you're starting to see some communities dial back because of the cost of providing that care. You're going to see progressive care options. They're still being built. You're seeing people move into those more quickly again. Again, real estate market is good, so it's a seller's market. So that's when people are moving. That really impacted, this should have been a really big year for people to move into continuing care communities. Because of COVID, that didn't happen. So we're going to see the fallout of that coming in 21. But you will still see probably good opportunities to get better pricing than might be typical in assisted living or in continuing care communities, and that will change in about a year. You're seeing a shortage of caregivers. You're seeing people, not just because of COVID and having to quarantine, you're seeing fewer people interested in the healthcare field, and you're seeing more communities and an aging population. So per capita, you're going to be seeing fewer caregiver labor pool. So that means they're going to increase rates, and that means costs are going to increase. That's where you're seeing that. So the future of a care approach, how do we manage all of this? Medicare has been increasing their focus on wellness rather than treatments in some situations. You're seeing a longer life expectancy, but higher and more complex care needs. So people are learning to manage more at home. And I think with technology and with services, they're getting more creative, and you will continue to see that, how to get more creative on providing care in the home, so people don't have to move as quickly. We talked about this the last time that I spoke, but adults, baby boomers, and people in retirement age are increasing rapidly, faster than children and teenagers and millennials are increasing. So you're going to see fewer caregivers, you're going to see fewer family members available. So you're going to see people relying a little bit more on each other. That's going to result in higher care costs and higher regulation. You're going to see more diverse options for lifestyle living. And that's where you really have to really educate yourself. And we can talk more about that, and we'll talk about it a little bit. But right now, senior living has changed a lot. You have retirement communities where you own, where you buy a house, lifestyle communities. You now have an increasingly large pool of rental communities at just about every single price point, including those for subsidized housing. You are seeing a really wide range of services available. So you have independent living with no services available, and then you have independent living with a lot of add-on services available that allow you to age in place. Same with assisted living. You're going to see a really wide range um, of budgets for people. You're going to see things coming in at the low 3,500s for assisted living or 3,000s, and they are going to be the bare bones, not a super high level of care. And then you're going to see very elaborate, newer assisted livings with full bars and masseuse and 1 and 2 bedroom apartments in high-end real estate areas with a lot of activity, a lot of luxury, and a lot of hands-on care. And they are going to be going for a premium. So you'll start to see $8,000, $9,000 budgets in assisted living as well. And it'll be what the market can bear. You're going to see more reliance on technology and less in-person care. So I think what's going to happen is you're going to see more emergencies happening. Since people aren't going to be getting into the office as much, they're going to be relying on monitors for diseases like diabetes, heart monitors, things like that. And then you are going, and even for pain. And you're going to see less people have time to be able to go out and help as people get more spread out. Adult children of retirees, people 55 and older, 65 and older, who are looking at early retirement, they're not available to provide the care. So you're going to be relying a lot more on services, and you're going to be relying a lot more on taking initiative to get creative among yourselves. But services will be available, but you're just going to start again to see the big gap over what Medicare is going to pay and the cost of some of these services. You're also going to see new treatments. So as these new treatments start emerging, new treatments for Alzheimer's, for neurological disorders, for arthritis, for MS, for diabetes, for heart, it's a wonderful thing. The challenge is going to be that they require a lot of work and coordination. So for you to get out to some of these things, there'll be people who were going to have a need or who are diagnosed with those are going to be reliant on kind of a home care team of family members and friends and physicians to help them put together a plan where they can not only know about things, about programs, but also have access to them and get to them because they don't come to the home for the most part. You're going to see a lot more self-management where people are going to be expected to track their own symptoms, track their vital statistics, and do self-reporting on that. And again, that is going to be very subjective. So I think we're going to see a year or two before that really starts to be effective. Exercise and emotional health in disease management, more and more science is behind it. So you're going to see a much greater emphasis on exercise, on not just staying engaged for your brain by doing games and doing activities, but taking a look at attitudes, doing things like meditation, yoga, managing depression, managing anxiety, and being willing to talk more about what's going on. So people need to start to think about being a little bit more willing to do that, engage in more groups, broach some of those topics. But again, be aware of your own anxiety about those things. And find at least 1 or 2 people that you can talk to and somebody who knows what's going on with you. Lifestyle expectations, again, you're going to see a lot of private pay services. So budgeting is going to be important and really starting to take a look at what you want things to look like. This will not look like, just like those going into assisted living now, it does not look like what it did 20 years ago when they were helping their parents find it. 10, 15 years from now, it is not going to look like what it looks like today. Again, you're going to see more level of care options for just about every level. You're going to see community living in naturally occurring neighborhoods, and 55 and older, you're going to see intergenerational living. And you've seen programs throughout the country starting, even sharing dorms at colleges with seniors who need a little bit of support. Isolation is already becoming epidemic because people are trying to stay more self-reliant, and what they're doing unintentionally is isolating and kind of keeping people at bay. So we'll need to start taking a look at ourselves and how we spend our time, how much time we allot to, and how much effort we put into making sure we're not just touching base over the phone, but getting out physically in person to see other people, inviting people into our homes, being available for those sorts of things, and monitoring our health, not just our physical health by our symptoms and saying I'm fine all the time, but really starting to learn to gauge how we feel about things, our depression, subtle symptoms that might indicate something else going on, and that's going to be expected of us. Okay, so it's a lot, and we're all going to be going through a learning curve together. The boomers are driving this, the need for, as well as what science is developing. So you've got a lot of new sciences, you've got a lot of new trials, you've got a lot of new protocols, but again, excuse me, you have to have access to those, and people need to know about them. So as we're starting to plan today, we have to start taking a look at what we're doing today. And that's something I know Jane and the Y reviews all the time. Nutrition, excuse me. Do I need to make major changes to my diet? I'm sorry. Are they small changes? Are they large changes? Diabetes, obesity, fatigue, how is that affecting? You know what, I'm going to take some questions right now while I get my breath. I just got over the flu, so while I'm doing that, if anybody has any questions or has any comments, you're please welcome to do that. Nobody?
Well, go ahead, take a moment, Carol, I know when you get that tickle.
I know, I'm sorry.
It only make the stress of like trying to keep going before you take a breath is worse. So just take a moment and catch your breath. But you know, and let me give you a second, and I'll just interject here and just so I think a lot of these things, because I've had a lot of experience with different places and moving my folks into different places. And I think one of the things that everybody needs to recognize, and this is what Carol is great at, and I'm going to share this because I know about you, Carol, I'm going to share this part of what you do, but while she gets back to her place and catches her breath. But so how I worked with Carol in the past, so she's actually, you don't pay Carol for her services. She's actually paid by the communities. So that's kind of the one nice thing, because when you enter into this, you don't know. Like when I initially started looking for a place for my parents to consider, my in-laws to consider, there's a lot out there, and there's a zillion different price points, and a lot of them are very high, honestly. So that's one thing just to be aware of, that whether you're considering this today or you're considering this maybe never, but sometimes you have to consider things like this because things happen. Like you don't anticipate things just have your health declining, and sometimes it's just these things just happen and you didn't anticipate it. So one of the things that I've learned in this whole process is that it's better to be proactive rather than reactive. So like you don't want to wait till a situation happens to you where you're forced to figure out something quickly. And so it's better to get a lay of the land, even if it's a year from now, or maybe it's even 2 years now, but what is it out there? What can I afford? What do I need? What do I need to be saving for? What do I need to be thinking about? And what fits my personal needs? So there's a lot of thought process that people should be having. And if it's staying in your place, great. But, you know, then if you're going to stay in your place, you need to figure out, you know, how you make that work for you as you age and as you may not be able to do everything. So what Carol can do in terms of the community, she can give you an idea. You know, you kind of, she gets to know you, she gets to know what your interests are, you know, what your financial issues are, where your budget is, and then make some recommendations. And then it's like, let's go visit. Let's just go check this stuff out and understand what the communities look like. And it's kind of like anything else. It's kind of like I equate it to, because I did it with my parents and my in-laws, and then I also, it was like finding colleges for my kids. Maybe some of you did that, but like everything has a different flavor, and they all cost different amounts of money. So you know, you kind of want to go visit and check it out. There, you know, right now it might be a little bit different, and Carol can speak to how you check some of that stuff out now, because it's different for sure. But you know, we're not going to be in COVID forever, and so I like to get people to start thinking about what 2 years from now might look like, because in some cases there's waiting lists. In some cases you just need to be mentally aware of what your next step is, even if it's not 2 months from now, or maybe it's you know 2 years from now. But it's really good to have an idea of the landscape. So Carol, go ahead and jump back in whenever you're ready.
Okay, thanks, Jane. I appreciate that. And yeah, and you know, and I think the analogy for college is good. You know, it's the feel for the college. Is it small? Is it large? Is it rural? Is it urban? But also, you know, when you take a look at their program, their academics, you know, if you want engineering, you want to go to a strong engineering school. If you want arts, you want to go to a strong arts. So, and it's that same way with senior living. So that's where you really have to, just like, you know, in high school, we figured out what is it we think we want to do with our lives, and start taking a look at what you expect out of senior living. I'm going to talk about that in the net. That's the next slide after this, because it is a very big changing field right now. But one of the big challenges is, or it's actually a pro. We can do a lot now to figure out how we want it to look. And staying in the home is absolutely an option. But what we realize is, no matter who we are, eventually, you know, we are aging, things occur, whether it be quickly or whether it be slowly. And at some point, we are going to need a little bit of help. And it may be very minimal, and it may be very feasible to stay independent at home. But then we also now, especially with boomers, we're taking a look at, is that really what we want? Because there's also the isolation, there's the same routine, there's the challenge, there's the engagement. So change and challenge and utilizing your brain and forming new relationships and staying active, those things are easier to do in community settings than they are at home. So my experience with this, and I've been doing this for a really long time, what you think now and what I think now for myself will not be what we think 10 years from now, and will not be what we think if or when our healthcare changes. So, you know, and my mother's a really good example. She was a manager of clinical case management. She had an idea of what she wanted to do. She actually managed Lutheran homes in Pennsylvania. So she thought, well, here's where I'm going if I need it, and here's what I want. And then as things went on, things started to change. She moved to Charlotte. She started to have a need. Then her bar changed. And then what she wanted changed. Then, well, if I can't walk independently, then I don't even want to be around. Okay, so then she started needing a walker. And then it was, well, if I have this. And finally, she was taking a lot of risks. And after a hospitalization, said, you really have to go to a community at this point, because you need too much access to things, and we can't manage the care and the firefighting. At least for now, you have to do that. And she did not like the idea. That to her was giving up. She got there, and within 3 months, her whole world opened up. And even though she was a professional and she did this for a living and she even managed some communities, it's very different when you start to see a supportive environment that matches the need that you have, and starting to make friends and starting to do different things. That's one example, but I use that just to illustrate we have no idea how we're going to feel in 5 years. And so one of the things I suggest you do is really take a look and reevaluate things every year or two with somebody. But for now, I'm just going to go back to this slide. For now, the things that we're doing now, we know are going to affect us 10, 20 years from now. So if you need to make changes in diet, start doing it now. Exercise and meditation, not just to manage physical need, but also that emotional need and the cognitive need, because they all play a part. And no matter what disease you have, just about all the science now is going back to saying how things like meditation, yoga, Tai Chi, exercise, how that's all interconnected in keeping you healthy. Hydration. The number one reason people end up in the hospital with confusion or falling is dehydration. So keep a cold glass of water. It doesn't mean you have to start suddenly downing a gallon of water a day. But keep a cold glass of water near you or in the fridge. I keep one in my refrigerator all the time. I pour it in a glass, it stays icy cold. And every time I open up the refrigerator or walk by, I open it and I drink part of the glass and I put it right back in. And it's become routine, and it's gotten me drinking a lot more water without feeling like I'm sitting down and trying to make an effort to do that. Those are the little changes you can do. um, Staying engaged. It becomes so easy, especially with COVID, and you've seen this all over the news, to become lethargic, to stop wanting to get dressed and go out, to get used to some isolation, to start changing your sleep patterns, your eating patterns. Um, and it's harder and harder to jumpstart that and get back out, especially when you need to you need to practice safety. But you need to do that, and it helps to have a buddy, and that's a great thing to do with the why. Check in on each other. What did I do today for my exercise? What did I do for my cognition? What did I do for my emotional well-being? Um, and just make sure that you're touching on those kinds of things each day, rather than um, trying to do things in major changes in major ways. Um, Develop small and large social networks. You need small networks for special interests and for people that you're comfortable with just hanging out and grabbing a coffee or calling on the phone, your core group. But you also need larger social networks, um, because things change, interests change, and you want to get to know what's out there. That's the way you get information. That's the way you share information, and that's the way you get to know other people who are retired, who are looking at things to do, and you start to build some friendships. But you have to make an effort to do that. Challenge yourself cognitively and socially. So say hi to a few people you didn't know. Pick up a phone a little more often, maybe once or twice a week, to somebody that you don't typically call. Um, and challenge yourself. Learn something new, read, join a book club. Brain games like Posit Science and Luminosity are online. You can do those sorts of things, and they can be effective. Um, don't be afraid of the words depression, stress, fear, attitude, gratitude, or joy. I mean, those are real things. Depression really happens. We don't see it coming. We don't typically wake up one day and we're depressed. Almost nobody says I'm depressed, and I'd like to seek help. Somebody lets them know, or you start to see the signs, and it usually shows up in your appearance, in your physical health, in your sleep pattern, in your diet, and in your interaction with other people. So we're doing less, we're saying yes to fewer invitations. And that's really hard to gauge while things are going on right now with 2020 and um, quarantines and not as many things being open. So we really have to make an effort to do that. Stress is real. It doesn't mean that if you talk about your stress that you can't manage your stress. It just means that be honest with somebody about some of the things that you're stressed about. You've probably had uh, you've probably um, had some challenges now, fearful about what might be happening to you, to your family members, um, to your neighbors. So fear is actually a very common thing. Attitudes, if there has ever been a year where attitudes needed to be have you know, have some introspection and take a look at it, it's 2020. We had everything going on, and so it's harder and harder to take a good attitude and keep a good attitude when there's a lot of chaos. Key to that is being grateful. I know myself, when I have tough days, I'm just grateful I have my own pillow to go to bed on at night, and that tomorrow's a new day. So gratitude that we're here and we're able to do that is the way that you can start taking a look at things that you can do to change and finding that joy, because identifying what makes you happy is going to be key to providing the kind of care that you need later on. It helps to support, to volunteer, to reach out to other people. That helps keep things in perspective, and to start participating in community programs to manage disease. So, exercise and disease management at the Y, physical therapy, balance programs, start to do things like big and loud therapy. Use a trainer if you need to jumpstart.
I think her battery went out, her
It's
computer.
mine. I kept searching and it was hers.
No, it was hers. Yeah.
That was kind of freaking me out just then, because I was sitting there looking, and then I was like, it didn't occur to me till that just happened, that was her battery.
Yeah.
So hopefully she can come back online. Goodness gracious, it's always something, isn't it?
Hey, that's what we're dealing with these days. You just never know what exciting thing will happen next.
I know it seems like it's, new challenges all the time, but do you guys have any, while she's hopefully kind of jump back in, do you guys have any questions that I can answer, given I've kind of worked with Carol and seen what she does? You guys have any questions about what Carol does or what she could do for you if you need it?
Yes.
Tell me, Gary.
Is insurance for long-term care a good option, or is it just a way to waste money?
Well, here's my experience with that. I had it worked once and I had it not work. So long-term care insurance, and she might be able to speak. I have only had a couple of experience with it, but what I found with it depends on if you meet the qualifications to have it kick in. So in one case, like my mom had Alzheimer's. And so her long-term insurance kicked in. And so we benefited from that. My dad had end-stage kidney failure and his never kicked in. So I think it depends on what you got, whether it works or not, I think. And maybe we'll get Carol back up because I'm sure she's much more better versed than I am. There she is.
Thank you. I apologize.
That's okay. Gary's question was long-term care insurance a good choice? And I had both experience, like with my mom with Alzheimer's, we benefit from it and it paid for some of her services. With my dad's situation, it didn't help at all. He couldn't tap into it. So,
right. So the short answer to that is yes, but understand what you're buying. And so that kind of goes into understanding the terminology in long-term care, because they're changing. So you have some that have cash out options. You have some that are good for skilled nursing or home care. And then you have some that are good for assisted living. So all of that can vary policy to policy. So sit down with somebody, if you have somebody, I would say review it with another person, get a second set of eyes. But typically in long-term care policies, the policies that are going to cover senior living, non-skilled nursing are going to say custodial care or adult care or community living that way. I've seen them all. I've seen some pay for either home care or assisted living. Some care for both. In tiers, you usually have a waiting period. So all of the different, I mean, every policy is unique. So talk to your insurance agent about that and get a second set of ears in with you. The one thing I would say that has happened with over the last few years is as care costs for both home care and senior living have gone up, premiums were going up on some of these long-term care policies. And so a lot of older folks were getting letters. We could either keep your premium the way it is or increase it. And they'd say, well, no, I can't afford new premium. So let me keep paying what I'm doing, and then you can change the benefit a little bit. But what was happening is that it wasn't enough for either assisted living or home care. So when that you make sure that you're taking a look at any changes in it too. But yeah, it is good to have. It's very good to have at this point. Typically start looking at that between the ages of 55 and your early 60s. Is typically the time to start buying that. If you have a need, a lot of times you can't get it. So
Jane, I have a one question.
sure.
Yeah, I have a question that I like to have a list of retirement homes or nursing home and retirement together around our Harris YMCA, not far from it, and comparative kind of study. If you like a comparison of 4 or 5 or 6
Okay.
retirement and nursing home, and then if Jen, can you email us? That would be so great help.
Well, I'd rather you this is something Carol would work with you directly on, rather than me. I mean, that's what she does. So you would talk to her. I mean, that's kind of how she works.
Yeah, Carol, we would
Absolutely.
like to do that. We like to have that information,
Great. Absolutely. So what I'm going to do then is put up my email at the end. It was there in the beginning. And so just as we finish this up, I'm going to go back to my email so that you have it.
Is there any way Jen can give you my email address to you? Because I don't want it to be shuffled out and gone in lost,
Sure.
Yeah, I'll give you her email address. I have
I
hers.
appreciate that. Thank you, Jen.
Great.
Thank you.
Great. Okay, so because there are a lot of options and the long-term care policy question was a good segue into this, realistically, we're not just planning for physical need now. The options are going to run, there will be a myriad of options available. And so one of the things that you start doing now, because you are active, because you are engaged, is start taking a look at asking yourself some very basic questions. And the people who have done this have had the most success in their move. Number one, what do I enjoy? And it could be things like hobbies, and it could be things that are more, sunsets and outdoors, things like that. But start to really drill down and see what makes you happy. Is it family? Is it friendships? Is it a lot of activity, things to do? Is it learning new things? Is it doing new things, staying busy? Is it privacy? All of those things, start to take a look at what's going to be important to you, as if you were giving somebody direction into how to best make you happy. These are some of the priorities that you feel now. What do I value most? Again, is it family? Is it my freedom? Is it great care, staying healthy? So you can start to take a look at those kinds of things. What are my
Carol,
health?
how do you define organize and create manageable space?
So organize and create manageable space would be starting to take a look at keeping your things together. So if you need healthcare related things, financial related things, make sure that you have those together and make sure that you have a power of attorney. and that you have family members who are aware of these things and where they are, and that you're reviewing so that they're not surprised.
I have a question on the power of attorney.
Sure.
Can we just write it down in a piece of paper and have a notary public sign and both the spouse sign, so that's sufficient document?
Hey,
Um,
Versha, I have a whole presentation on power of
Okay.
attorney and what you should do. I'll send it to you, but you should listen to that because that's probably not the best idea.
Okay.
But we did one of these seminars with attorneys, so.
Great. Yeah, and
Thank you.
remember,
Sorry to disturb you.
no, that's
No.
fine. And if you can speak for yourself, that power of attorney is invalid if you make a choice. The only thing I would add to that is be careful about making each other's spouse as the power of attorney. Make sure you add somebody else to that.
Yeah, witness sign.
Yeah. So, so realistically, what are my health concerns? It's great to say I'm never going to need something, or I don't want to think about that. But if we know, if we have arthritis, if we have diabetes, if we have weight issues, if we have trouble managing our meals or eating regularly, if emotionally we need to be around people, if we're a little concerned about, we're feeling foggier, and maybe we have concerns about cognition, whatever those concerns are, they're going to play a part in your health. And you want to make sure that you're talking about those now, because that will play into choosing a community, because every community approaches these things differently. Who am I going to rely on for my caregivers and power of attorney? There's a lot of management. So when somebody goes to a community or has care at home, there's a lot of management. So have somebody available to help you with the process, help you with paperwork, know where things are, be the person that to be called in an emergency, and know something about you and what your preferences are and what your routine is, what your medications are, things like that. So make sure that they are informed, and make sure you're being realistic. If we think our children are going to be our caregivers, make sure that they are on board, and make sure that their lifestyle will allow it. If they're in California, that's going to be hard. If they have kids in middle school, that's going to be hard. So have those conversations. Get honest with people. You don't have to go tell the world exactly how you feel, and you don't have to, and you can, engage and be the person that you want to be. But if you are fearful about something, if you are anxious about something, if you are feeling great, if you have thoughts about anything with your care, or your fears of it, or your attitudes toward it that you want to share with somebody, no matter what it is, have somebody that you can talk to regularly, because you need to be able to do that. Understand your finances. Too often people don't really understand what their finances are. They assume they're getting Medicare to cover it. They assume they're getting Medicaid when they run out of money. They aren't sure, or one spouse is managing it. But know what your finances are, because you have to have a plan, not just for assisted living, but if you're better off in an independent community with services to keep you from needing assisted living later. So start having that conversation realistically. Review your living will and your care strategy every 1 or 2 years, or after a critical event. People's attitudes change. So, and that is about the one thing that you can be guaranteed about. Once they go through a new experience, their attitudes change, and they may be rethinking a lot that's in some of that documentation. Either way. So creating manageable space is get out of the clutter. Start getting rid of things that you don't need and that just don't make you feel good anymore. If there's no reason for it, let it go. If you've got a garage full or a spare bedroom full of furniture from when you downsized before, and you think somebody might want it, have people claim those things now. It is about being able to think more clearly. It's about not being tied down, so that you can't make decisions later, but it's also about keeping yourself safe. You need that space. You need space for things that are applicable to your life now. And you need to have some things organized because, again, like Jane mentioned, you don't want to be fighting fires. Don't wait till it's an emergency. Take a look, and this is a good starting point. It's hard to imagine what things are going to be like 5, 10 years from now. Take a look how it's changed in the last 5 years and start from there. Um, any physical changes, any challenge that you have, any attitude changes that you might have, friends that have gone, moving, neighbors that have moved, seeing your kids less, seeing your kids more, all of those things, your finances, things costing more, um, having more of a budget than you wanted because you haven't spent it in 2020 because things were closed. So whatever it is, kind of take a look at how things have changed over the last 5 years, and use that as a starting point to at least anticipate that things will change in the next 5 years. Um, and so that you can start to plan for that, plan for both the known and the unknown. Um, get your long-term and your short-term physical goals. So short-term, to stay as healthy as you want to have as much of a network as you would like to, but then long-term too, your long-term physical goals. If you've got a chronic disease, again, like arthritis or a heart condition or diabetes, um, or vision issues, start planning now because in 10 years, it's going to be harder to plan that. Your abilities will change. And the more you do now to prevent drastic changes, the healthier you're going to be and the better your outcomes. So keep with it, measure it, don't stare at it. It's not like you're standing on the scale all the time, but be aware of the changes in you, and be okay with that. And then create a plan to achieve your goals. So if you want to stay physically healthy, get those programs in place, start walking, and also have a backup plan if you need something. If you have a 2-story house and all of your bedrooms are upstairs, think about where you would put space if you needed it. And then for right now, just be happy, embrace what you have. It's great. You've got friends and you're doing things and you want to keep it that way, but be open to change. And that fear of change is one of the biggest things that leave people unprepared. So know that no matter what age we are, whether we're a child, a teenager, a young adult, midlife, later years of working, early retirement, or older, things are going to be changing. So we just have to be adaptable. And that's what all of this is preparing you to do so that you can find the best life no matter where you are in that process. And I've seen many people do it very, very successfully. And these are some of the common things. They were prepared. So that's what I want to share with you.
Wow. Well, thank you so much, Carol. If you guys want Carol's email address, she'll put it up here, or you can reach out to me. I'd be happy to get it to you. It's on the screen right here, her information. But if you don't have a pen handy, send me an email and I can share it with you. But thank you, Carol. I'm a huge planner, and I have seen things done both ways. And a plan is always so much better. And I've seen people moving, been so set on staying in one place. But some subtle changes. My father-in-law moved into, had to move into a little bit of assisted living, not very much, but actually just met somebody who supported his diet, and he's been on insulin for 30 years and they just took him off insulin. I mean, in a matter of 6 months. So, I mean, crazy things can happen sometimes. I couldn't imagine that would ever happen, but you'd be surprised sometimes, change of circumstances, people get out of their norm and all of a sudden they make really positive changes for themselves, not even intentionally. So,
right. And that's it. And that's one of the things I see. I mean, we have to be prepared that we're going to change. But the reality is, oftentimes the changes are really positive changes.
Yeah,
You grow your social circle, you become more alive when you're around other people. So, and when you're prepared for things and you keep that stress level low. So just like your father-in-law.
Yeah.
Like
So
mine.
anyway, I'm just a big proponent of this, and Carol, I really appreciate you. Carol's a great guide. If you want to, and you don't, like I said, there's no cost to you to just explore what's out there when meeting with Carol. And if you go and visit community, you need to visit with Carol first before you go and visit the community, because that's kind of the way the system works. So I encourage you, if you're into that space, check with Carol. So
Yeah, and I can help you with
thank you.
questions. Yeah.
Yeah, so thank you, Carol. Appreciate you being here.
Thank you.
Next week, we have Carol Green, and Carol is a nutritionist. She's so much more than that. She's been a chef, but she's going to talk about diet and immune boosting foods to eat. So basically kind of like simple swaps, like, you've maybe seen this before, but instead of eating this, eat that. Foods to boost the immune system, which I think going into this cold and flu season and COVID season, learning how to make better food choices is what we all should be thinking about. So Carol Green will be with us next week from A Taste of Healing, and I hope you guys will come back. So let's see, is there another chat here that I need to see? Yep, thank you. Just some thanks from everybody. And Carol, once again, thank you so much for being here with us.
Thank you, Jen. I
Okay.
enjoyed it. Take care, everybody.